Hello, everyone. Today we have a very special night. We have a presentation about how to crack MCQ exam. The presentation will be presented with our professor, Professor Ahmed Halawa. He's working in Sheffield Teaching Hospital. And our moderator today is Professor Yasser Abdelhamid. He's a professor from Cairo University. So I will give the floor now to Professor Yasser Abdelhamid to present Dr. Ahmed Halawa.
Thank you, dear Rami, Rami Abu Bakr, our coordinator today. Good evening, everyone. Welcome in this meeting of Egyptian Society of Nephrology and Transplantation, CME chapter meetings. And this is our usual time, Wednesday every week, 9:30 p.m. summertime, according to Cairo time. Today is a special meeting, as Rami said, regarding medical education meeting, not specially directed to whom are interested in nephrology, but for all medical students and postgraduates who are planning to pass their exams, and also for all who are interested in medical education, how to design MCQs, multiple choice questions, and how to deal with multiple choice questions, how to scientifically deal with multiple choice questions. We have the pleasure and honor to have our great speaker today, Professor Ahmed Halawa. Professor Ahmed Halawa is one of the Egyptian and UK professors, and we are honored to have Professor Halawa working in UK as one of our professors. Professor Halawa currently is the consultant general and transplant surgeon in Sheffield Kidney Institute, Sheffield Teaching Hospital in UK. He is emeritus professor of the University of Liverpool in Liverpool, UK, ISN ambassador of transplantation and endocrinal surgery, and the program director and postgraduate education in University of Liverpool. He is also program director of World Kidney Academy and especially of transplantation. He is busy visiting professors in many universities. Professor Halawa received his MPPCH from Cairo University, my university, and I am pleasured to know this. And his master degree from the same university. He went to UK and received his MD from University of Sheffield in Sheffield, UK, and FIS Royal College of Surgeons, Edinburgh in UK. His main interests and postgraduate regarding our meeting today, he received the postgraduate certificate of medical education and master's degree in higher education 2012 and 2015 respectively. His main interest is surgical regarding nephrology. He is interested in kidney transplantation and parathyroid gland surgery of secondary and tertiary hyperparathyroidism, and of course primary hyperparathyroidism, laparoscopic donor nephrectomy, open nephrectomy, and all urological operations known for us as nephrologists, and medical dealing with highly sensitized patients, EPO, incompatible blood transplant, preoperative preparation of both donors and recipient, and management of post-transplant medical complications. Regarding our meeting, he has led many educational events in transplantation, program director of postgraduate education and transplantation, and program director of postgraduate education sponsored by the Arab Society of Nephrology and Transplantation. He received many awards, especially in ERA EDITA meeting in Copenhagen 2012. The best, one of best 8 abstracts, poster of excellence and poster of excellence twice, and command awards from first UK Enhanced Recovery in Renal Transplantation in the awarded Enhanced Recovery Summit. Clinical Excellence Awards from Sheffield Teaching Foundation, and Clinical Excellence Awards by Sheffield also Teaching in 2012 and 2013 and 2018. He had many 83 international presentations and 156 publications, including 3 book chapters, editorial board in many scientific journals, and supervised many MSc and PhD degrees. Not only of his scientific activities, he is also interested in music, and he is graduated also in music from Victoria College of Music and Drama in London in September 2020, we can observe that is within the COVID era. He was graduated even in music, the COVID area of the great achievement, and he is especially interested in fluid and performance, and composed many than 100 music sheets in Egyptian and Western books with publications, and we are waiting these music sheets as we are waiting all of your presentations and scientific activities, Professor Halawa. We are honored to have you today as to present this meeting about how to deal with MCQ regarding exam formation and exam passing. And I will leave the floor to you to go to your lecture and come to you again by the end of the lecture for discussion. Please, Professor Halawa.
Yeah, thank you very much, Professor Yasser and Professor Rami for this kind of introduction. Above all, I'm still learning and I keep learning. And when you learn, you'll be able to teach. But without being taught, you can't teach. So basically, why I've chosen this topic to teach, because, everything is MCQ based these days. Royal College exams, every known and unknown exams, any fellowship exam as well, worldwide, is based on MCQ. There is definitely an art how to answer the MCQ, and there is, of course, an art how to design the MCQ. How to design the MCQ is to counteract what I'm going to tell you today about how to design the MCQ. So in order to get the MCQ more difficult, you do the opposite. Also, there are several types of MCQs. Exam MCQs and teaching MCQs. Both are different. Teaching MCQs, basically, you would like to pass the knowledge through the MCQ, pass the information through the MCQ. Exam MCQ, where you need to test whether the candidate knows or he doesn't know. Both are different. So it's a massive science, and hopefully I will be able to summarize what I can summarize today in this form of the lecture. Lecture is tutorial with examples, and we'll give you some MCQs at the end and try to, answer them together. Fine, so I use the word crack. Crack means something illegal. You crack a safe, you crack the code, means something illegal to do. But actually, it's not legal. It's not illegal. It's legal, provided that you know how to do it. This is a bit about myself. Professor, consultant transplant surgeon, chief of teaching hospital United Kingdom, member of panel of examiner Royal College of Surgeons for the MRCS exam, member of the panel of examiners Royal College of Surgeons for the FRCS exam, director of World Kidney Academy, also examiner Sheffield Teaching, Sheffield University and Liverpool University. And also I'm a member of panel of examiners Royal College of Surgeons of England as well. But the page is too small to add all this. So cheating may expose you to unnecessary embarrassment. We don't need to cheat. If you know the art, if you have the knowledge, you don't need to cheat. MCQ can be cracked if you know the answer, if you prepared for the MCQ. I'm teaching you how to pass the MCQ exam without cheating. So the objective of this talk is how to score the highest mark if you studied very well. But this is not always the case. Sometimes you have to give it a guess. One or two of the options given, you haven't heard of them, you don't know anything about them. So how to do the guessing. In this case, called educated guess. Sometimes you have to do blind guessing, where a question out of the blue you haven't heard of before and came in the exam question, exam paper. This is called blind guessing. There is also an art for blind guessing. It's all about, you have to understand the psychology of the examiner. You have to understand the personality trait of the examiner. it's advisable that you practice some of the exams designed by the same examiner before to know his trait. So to start with, you get an exam paper, you need to read the instruction first carefully. Don't rush into this question without reading the instructions. This provides you with a valuable information regarding how to take the test. For example, use pencil rather than fountain pen. Time allowed. Negative marking for wrong answers. You have to slow down if there is negative marking for the wrong answer. You have to think twice before you scratch the paper with your pen. I studied well and I know the answer, but still you can lose marks. Trust me, still you can lose marks in spite of knowing the exam question very well and knowing the answers. I will tell you why. What you need to do first is screen all the questions, eyeball all the questions, run through all questions, but not in depth. You may find an easy question to answer quickly. This will save you time and will score you a mark. Also, this helps to prime your brain for the more challenging and difficult questions. So screening, you can take an easy question quickly. This saves time. Also prepare your brain for more challenging questions. Not only that, some questions may have answers to other questions, and this is why you need to screen all questions in one go. Some questions may have hints to other questions. We often think that you know what the question is asking before reading it and jump straight into an answer and answer it. This is a very big mistake. Without reading the question carefully, without thinking and try to answer the question in your mind first, you rush into the answer. It could be the answer you ticked is a correct answer, but remember, and I will rehearse this and empathize on this later on, the MCQ is asking all the time for the best answer. You could have many correct answers, but one of them is the best. When you read the stem of the question, answer it first in your mind without looking at the options. This will help to prevent you, it helps in preventing you from drifting away from the correct answers. So not wasting your time in the wrong answers. Try not to get distracted by the options. This is a very valuable rule in answering the question, which is elimination, called rule of elimination. Basically, you eliminate the wrong answers first. You know it's 100% wrong. Just let me remove this. Not only does this strategy save time, but also increases your likelihood of selecting the correct answer. So if you eliminate this one, I eliminate this one, I eliminate this one, I will be left with D, option D, which is the correct one. Always select the best answer. Most of them asking for the best answer, not just the answer which seems correct. Many answers will look correct, but which one is the best? This is what the examiner is after. Read every answer option. Read every answer option prior to choosing the final answer. Some of the answers may seem straightforward to some, but they are not the best. And this is a common mistake. Remember, we need the best answer. And I kept repeating it. We need the best answer, not only the correct one. Because the correct answer may not be the best answer, and the correct answer may not be the correct choice. Answer the questions you know first. What about if I have difficulty in answer one question? Move on. Don't stick to it. Don't get stuck. Move on. You may find hint later on, or you may find question which leads to the answer of the difficult question. Don't forget, when you answer many questions, this will prime your brain to the difficult ones. Of course, we know by experience that some words could attract more attention and may direct you to the answer. We call them qualifying words like all, most, some, never, always, usually, more. There's a rule. Always is always wrong. Never select never. When you see always, when you see never, most likely these are the wrong choices. Remember, always is always wrong. Never select never. Stick with your first choice, but not always. Your first choice most likely is correct, but not always correct. If you are confused, check to your first choice, because most likely this is the correct one. MCQ are not designed to trick or confuse you. They are designed to test your knowledge and ability. Any MCQ question has most common wrong answer among the choices, answers that seems logic but ultimately wrong, or answer who are the best answer, and this what we are after. This is what we need to take. Some of the questions have all of the above and none of the above. There are certain rules for all the above and none of the above, which is easy to formalize. Do not select all of the above if you're pretty sure that one or more of the options given are incorrect. The same applies for none of the above. If you are confident that one of the answer choices is true, so none of the above is wrong, you shouldn't select none of the above. If you are an examiner in the Royal College, by the way, or being asked when we design MCQs, no single MCQ should have all of the above, none of the above, because it's easy to pick up the correct choice, knowing that if two choices are wrong, so all of the above won't be applied. Even one choice is wrong, it can't be all of the above option, and the same for none of the above. Manage your time. Imagine the exam time is 60 minutes and you have 50 questions to answer. So roughly speaking, so 1 minute for each question, so 50 minutes and 10 minutes for review. But this is not always the case because some questions take longer than the other, but it should be balanced out. You should manage your own time based on the time given and the number of MCQs you have to answer. Above all, practice, 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 practice. Not only practice without knowledge, study and practice. And as I mentioned early on, it's advisable to know the personality trait of the examiners by reviewing some of his exams to know his pattern. I don't have a clue. So a question or option which you never heard of before. How can we answer this question? I put a lot of not everywhere. So all guessing techniques are not a substitute of proper test preparation, which include practice, the MCQ exam, and studying the topic. They are not 100% correct. All the guessing techniques, whatever I'm saying, not 100% correct. Not guarantee as well to have the pass mark if you didn't study well. They will, however, help all these guessing techniques in limiting and narrowing down the choices or choose between two reasonable good answers. So it narrows your selection margin, the margin of selection. So it increases your chance from 25% to 50% of getting the correct answer. The myth of C. I think there's a myth that C, if you don't know the answer, choose C because most likely the most correct answer. This is completely wrong. A myth. Numbers will never lie. Statistics will tell us. Surprisingly, C is no different from any other option. But if you have to give a guess, and if you're going to stick to one option like C, keep sticking to it all questions. 5 questions, I don't know the answer. And instead of giving random options, 1A, 1B, 1C, 1D, 1E, no, stick to one. Do you know why? Based on the statistics, if the examiner didn't randomize the answers, you have double chance, your chance will be doubled to get the correct answer if you stick to one option order. Let's just say A all the way through. For the 5 questions, I didn't have that. I didn't have the knowledge to answer them. Or B. So the 5 questions, I will choose B option, B option, B option, B option, or C option, C option, C option, C option. But if the exam answers are randomized, this technique won't work. Because some of the examiners, they won't give a damn about randomizing the answers. Every test maker is different. So we need actually to know the psychology of the examiners, because some of them wouldn't be interested in randomizing the answers. And you can tell how they design the questions. Option B, Surprisingly, if you have 4 options, A, B, C, and D, B is the highest one as far as statistics is concerned. C comes next. And if you look at the margin here, this is 28% for B, 25% for C. Not big difference. But if you have 4 options and you don't know the answer, I would choose B. What about option E? Actually, if you have 5 options, the E option, which is the 5th option, has the highest probability of being right compared to C. All about the statistics here. Fine. I will tell you a trick here. Examiners tend to emphasize and put more information in the, and put a lot of effort in the correct answer compared to the wrong one. So when you find the correct answer a bit longer, correct option is longer, 2 lines, 3 lines, compared to the other options, 1 line, even less than a line. So if you have 5 options, one of them has longer statement, more explanation, most likely this is a correct option. Also, in most cases, a positive option probably true if there is a negative one. We tend, this is based on the examiner psychology and our psychology as well. We put more emphasis, we become more interested naturally in the positive option rather than the negative one. What about if you have all of the above and none of the above and you don't know any of the other options? A, B, C, and then D, all of the above, E, none of the above. If you don't know the answers, and you can't tell, you couldn't tell at all option A or B or C, whether any one of the options is wrong or correct, you have no idea. You're talking about something you never heard of before. In this case, I would choose all of the above. More likely to be correct compared to none of the above. Again, all of the above is a positive option. Word, a phrase, or a concept you have never heard of, most likely is the wrong answer. And it could be irrelevant as well, means a wrong option. Of course, as I mentioned earlier on, always or never, always is always wrong, never use never. Look for a hint in another question. This may give you a clue. And this is emphasize the importance of screening all questions first. You could find 2 related questions. One will give you a hint to another one. Irrelevant option, throw it out of the window, must be wrong. Sometimes if you have values and numbers and you don't have a clue, most likely the middle range, middle order option is a lot safer. Nearly similar statements, one of them is the correct answer. Opposite statements, one of them is the correct answer. If you have an option with spelling mistakes or grammatic error, must be the wrong option, incorrect option. Remember the rule I mentioned early on? Examiners tend to emphasize more, put a lot of effort, put a lot of time in the correct option, ignoring, undermining, no emphasis at all on the incorrect option. They may miss spelling, grammar, or may not look right. Umbrella option strategy. This is very interesting. When one option encompasses and includes and involves other options, most likely the inclusive one is the correct option. And I will give you an example later. Frequency of occurrence strategy. This strategy is well known and increases the likelihood of getting the correct options. Look for items that appear more than once in the choices. This might direct you to the correct answer. Fine. Sometimes you get true and false questions. Ideally speaking, hypothetically, you should have 50% true, 50% false. But this is not the fact. More likely to have true answers compared to false answers. And this percentage, based on the statistics done by this researcher, William Poundstone, and he published a nice book about how to win the lottery, how to guess even the lottery number. It is easier for an examiner to write a true statement rather than false one. The chance that next answer will be different from the present one is 63% in Poundstone study. What was expected to be 50%, but is not 50%. Again, if you have true answer, most likely the answer follow the true answer would be false in 63%. Therefore, go through the entire test and make the answer you know and mark them before attempting any guessing. Rule of thumb, guessing should be at the end if you have no clue or we are running out of time. But don't guess at the beginning, you will screw it up. Back to the true and false. Look at the known correct answers of the items before and after the one you don't know. Should the one before and after differ, guess true for the middle one. So if you have false, this is the one before, and you have true, the one after. In the middle, most likely is true. When both neighboring answers are the same, guess the opposite. It's common sense. If you have false, false, the third one has to be true. And this is actually a demonstration of what I explained early on. Two similar on the left-hand side, the one in the middle must be false. Two different, even if it was the other way around, false and true, the one in the middle to be true. Because the likelihood of true answer is higher compared to the false answer. Finally, do not leave any answer blank. Unless there's a negative marking, if you have 4 option question, the chances of getting the correct answer is 25%. But if you apply some guesswork and some of the rules I mentioned on, you might get the percentage higher. If you don't know any of the questions, stick to one option, one order, A, all the way through. B, 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 C, 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 rather than making it random. What about matching questions? They are very common questions. We'll apply nearly similar rule to this. Matching question, by the way, the way they are designed for is they come with terms and definitions. And you must match the terms with their explanation. Read both lists carefully to get an idea of all the options. As you start matching the items, look at the one list and formulate an answer again in your mind before searching the other list. So you have to answer it in your mind first and then look for matching with the other column. Don't guess at the beginning, guess at the end. Sometimes you don't need to guess if you start matching what you know, because what you need to start with the question you know first, with the matching you know first. You are 100% sure first. And then you will be left with the weird one, which you don't know the answer, will match itself to the other column. Guess at the end, not at the beginning. Fine, let's go through some exercises, and it's quite entertaining and needs interaction, so we can open the chat box if you don't mind. Example number 1. Choose a correct answer regarding the Russian-Ukrainian war. Oh my God, I have no clue. But let us apply the rules. The conflict started in 2014 following Ukraine's revolution for dignity, where Russia occupied Crimea from Ukraine and supported pro-Russian separatists. This is option number A, option number B. The war started in 2015. The war ended in 2022. China supported Ukraine by sending troops. The war involves Semitism. So the correct answer is yeah, we have very excellent guesswork here. With little knowledge, we know that, the war hasn't ended yet. It's still killing each other. I don't know when did the war start. Anyway, the answer is A, yes. The correct answer is A. Let us read the explanation. You have the slide on the right-hand side here. Long sentence in A, probably the correct answer. If we do elimination, the war started, not ended in 2022. The war did not end till now. So elimination, I deleted this one. China did not support Ukraine by sending troops. I haven't heard of Chinese soldiers involved in the Ukrainian war. Elimination. The war involved Semitism. Grammar. The war involved. The war involves or involved. So there is a grammatic mistake here. And Semitism, I never heard of. Spelling mistake, grammatic mistake, unusual wording. Probably this is a wrong answer. So we are left with A because the long sentence. And when we apply elimination, in addition to knowing that one of the option has wrong spelling mistakes, and even grammatic mistake. Example number 2. Choose a correct answer regarding Chinese civilization. Chinese civilization first emerged in the Yellow River Valley. China maintains a rich diversity of ethnic and linguistic people groups. The predominant language is a Standard Chinese, which is based on Beijing dialect. China was first united under single imperial state by Qin Shi Huang in 221 BC. All of the above. Which one is the correct option? Any volunteer? Any more? Look, I don't know anything about China. I'm not Chinese even. Yeah, E. Yes. The examiner is asking for the correct answer, only one answer. And I spotted some correct answers. So it must be all of the above. Yeah? With little knowledge, you can score example number 3. One of the following statement is not true. Look, I'm an examiner and I'm playing with words. So this is why you need to read the stem of the question carefully to find out what the examiner is asking for. According to the 2021 census data, 82% of people in England and Wales are white, 18% belong to Black, Asian, mixed, or other ethnic group. English is a spoken language in the UK. The Welsh language has never been practiced since the Civil War. The United Kingdom is an island nation in the northwest of Europe, consisting of England, Scotland, Wales, Northern Ireland. The United Kingdom is a diverse country with many different cultures from all over the world. The correct answer is I think I'm going to trap you here. Have you noticed something? We're asking not true. So I rephrased the exam question, the stem of the question. So the examiner is asking for the incorrect answer, the wrong answer. And the correct answer for this question is the wrong option. We have smart people here. Yeah. Okay. The correct answer is C. Why? Imagine I don't live in England. I'm French. So the examiner is asking, actually a tricky question, is asking for the not true answer. So he is after one not true answer. Apply elimination. There's more explanation in A and D and E, more likely to be true then. So we'll eliminate this option because the long sentence, they look correct, and the examiner is asking for the incorrect option. Have you noticed the word never in C? It said never, select never. So straightforward C is wrong. Actually, Welsh language still practiced in part of Wales. Example number 4. So to give you some medicine, one of more, just let me move this. One or more of the following statements is or are incorrect regarding symptoms of DVT. Throbbing pain in the affected leg always affect the deep veins in the pelvis, is never associated with swelling, warm skin around the painful area, red or darkened skin around the painful area. This may be harder to see in brown or black skin. The correct answer you can see is B and C. Why? The examiner is asking for the incorrect answer. Never and always. Straightforward. I will know they are wrong. One or more of the following statements are incorrect regarding pulmonary embolism. Patients with sudden onset present with sudden onset of shortness of breath, associated with chest pain, associated with hemoptysis. S1Q3T3 pattern is 100% sensitive. CT pulmonary angiogram is only 7% sensitive. Which of the options is or are incorrect? Remember, is or are incorrect could be more than one option. I need to know why you selected D and E. Yeah, it's D and E, but why? Just write in the chat box, 100% and only. Excellent. Yeah, what else? What about CT pulmonary angiogram? Is only, yes. Excellent. I'm impressed. Something else is important. Have you noticed two extreme numbers, two extreme values? As a matter of fact, S1Q3T3 is sensitive in only 20%. Pulmonary angiogram is sensitive in 95%. Yeah. But you know, the word here is 100%. Nothing is 100% in life except you die. Yeah. Example number 6. The average number of volcanic eruptions reported annually is 450, 450, 15, 20. So the correct answer is C. Remember the middle order if you don't know the figures. So the middle orders here, of course, not 450, not 400, but not 15 as well. So it is between 50 and 20. One of them is a correct one. If you give it a good guess between the 20 and 50, you have 50% chance to mark the correct option. Middle range, middle order, middle value. Remember. And it can't be more than one number. This is another common sense. He's not asking for the average. So example number 7. Choose the correct answer regarding the ECG finding in acute coronary syndrome. Acute coronary syndrome is never associated with T-wave inversion. Bedside echo is not useful. HT segment elevation more than 0.5 millimeter. New T-wave inversion more than 2 millimeter in more than 2 contiguous leads. All of the above. Correct answer is D. But the one who chose C, I will admire him for this, but it's not a correct choice. Have you noticed something here? Fine. So the word never. So this is the wrong option. Bedside echo is not useful. Common sense. And also is a negative statement. So it's not correct one. So all of the above cannot be all of the above. Cannot be E. So I have the two options here. HT segment elevation more than 0.5 millimeter. New T wave inversion more than 2 millimeter in more than 2 contiguous leads. But the clue is still here, because have you noticed that this D opposes A? And A doesn't look right because the word never. So even I have no idea about the ECG, never heard of, but I'm going to use D because it's opposite to A and A is wrong because of the word never. B is not, this negative statement unlikely to be correct one. ST segment elevation, it is depression rather than elevation, but if I don't know, these are two opposing ones here. And this one opposes this one. So most likely it's D. It's wrong. It's the correct choice. Fine. So let's just have some fun with the true and false questions. So the Berlin Wall came down in 1987. Is it true or false? True. Remember, I have no idea about Berlin Wall. Never been in Berlin before and never read about it. I know it came down at the sub stage, but if I'm going to guess, most likely I will choose the true one because the examiner's psychology will emphasize on the true statement on the positive one compared to the negative one, if I don't have a clue. Fine, example number 9. Choose a correct answer regarding the World War II. Began in 1st of September 1939 when Germany invaded Poland. The UK and France declared war on Germany on 3rd of October. Germany controlled much of continental Europe, most of West Africa, many parts of South Asia. Very close to 1,000 people died in the war. Airstrike affected mainland, but rarely affected Britain. Correct answer is A. Let us analyze it. This is a difficult question, and none of us was born at the time of the Second World War, and even our dads not born at that time. Also apply common sense, since Germany did not go to the West Africa or South Asia. So this eliminates C straight away, elimination technique. Look at option D, the wording suspicious, very close. They said very close to 1,000, 100,000. And also, the people died, common sense, common knowledge is in millions, not in thousands. So this one is wrong. See option E, where rarely, the word rarely there, option E here, is rarely affected Britain. Come on, you know, German bombarded London. London was put down to earth. So you will be left with two options here, A and B. So this will actually limit your puzzle to two options. So you have 50% chance of getting the correct answer. And A with the correct one. So the whole idea is to limit the chances of getting it wrong by knowing these rules. Example number 10. Please show the correct statement regarding, I think most of you will know it, recent Gaza-Israeli war, condemned by the international community, started on 7th of October 2023. The international community supports Israel. I will give you an example. Most of you will know it. The Arab countries support Palestinians. The West Bank is involved in the conflict. Fine, let's apply elimination here. In spite of I know that it starts 7th of October, but remember, the examiner could be looking for the best rather than the correct answer. But to be honest, nothing is best compared to figures and numbers in the statement. So condemned by international community, who said that? America didn't condemn it. It started in 7th October, yes, is right. International community supports Israel. Not all the international community supported Israel. The Arab countries support Palestinians. Who said that? Not most of the Arab countries supported Israel or support. West Bank is involved in the conflict. No, West Bank was asleep in bed. So B is an option. Apply elimination first. Number 11. Choose the incorrect statement regarding the Japanese language. So this is a question you never heard of. You don't know anything about it. Remember, the examiner as well will know about it. He must have emphasized the correct choice. It consists of ideogram and phonogram. More than 124 million people speak the language, spoken exclusively in Japan. The accent is a pitch accent, written vertically. So the correct answer is the correct choice is C. Yeah. Why? Why did you choose C? Exclusively. Well done, Dr. Muhammad Abdul. Yes, this is one of the qualifying words. Look, Japanese families living in the States most likely they use the Japanese language at home. Indian in the United Kingdom, when they speak together, they speak in Hindi. Chinese community in the United Kingdom, they speak with each other Chinese. Pakistani community the same, Arab community the same. The word exclusively will attract my attention straight away. Yeah. Fine. Let us play together here. Choose one correct answer regarding reduction of your anxiety during exam. Practicing relaxation techniques, deep breathing, muscle relaxation techniques, close your eyes, imagine a positive outcome. So the correct answer is fine. So Rami, my moderator, why did you select A? Dr. Sadiq Babakr, why did you select A? A includes all of them. Well done. Yes, yeah. This is called the umbrella technique, umbrella option. So if you look at deep breathing, which option B, muscle relaxation technique, option C, close your eye, option D, imagining a positive outcome, option E, all of them are relaxation techniques. The examiner is asking for one correct answer. So this option A includes, involves all the other options. So option A is the correct option. Fine. The following languages are spoken in Comoro Islands. I have no idea where is Comoro Island, never heard of, but of course I don't. Let us answer the question. Spanish, Arabic, Arabic, French, German, Italian, French, English, Russian, and Swahili. Which option is a correct option? Fine. Okay. Okay, fine. So let's just see here. This is Arabic. So being repeated twice. Okay. Spanish, repeated once. French here, so repeated twice. Russian once, Swahili once, English once. So we have Arabic repeated twice, we have French repeated twice. It must be the option which includes Arabic and French. B. Remember the rule? Repetition. If you have an option repeated, you have words repeated in more than one option, most likely the option which encompasses this word is a correct option. So the answer is B. Number 14. So matching question. Match the two columns. One column on the left-hand side, diabetes, cardiovascular disease, smoking, peripheral vascular disease, obesity. On the right-hand side, type 2 diabetes, MI and stroke, the commonest cause of renal failure, the leading cause of death globally, lung and cancer. Again, rule of thumb, what we do, we shouldn't answer them in order, but we select the match we are sure about first, leaving guessing to the end. So smoking, I'm sure it can cause lung cancer. Obesity will get you type 2 diabetes. Cardiovascular disease, the leading cause of death globally. Diabetes is commonest cause of renal failure. Of course, most of you are renal physicians. And then I left with peripheral vascular disease. So I have to choose MI and stroke, and definitely is correct. So I didn't follow the order, but I followed what I know best. Last question, match two columns. This is purely transplant for the sake of fun. Tubulitis, BK virus infection, CMV, renal artery stenosis, PTLD. On the right-hand side, B-cell lymphoma, Tardas parvus. I have no idea what Tardas parvus is. Of course I know. But imagine the first time you come across it. T-cell mediated rejection, ureteric structure, owl eyes. Rule number 1 in matching question, choose the match you are 100% sure of. For example, owl eyes, it happens in CMV. This is straightforward. PTLD, it's a B-cell lymphoma. Look, I didn't follow the order. BK virus infection and ureteric structure. Tubulitis, it must be T-cell mediated rejection. Now I don't need to guess because I'm left with renal artery stenosis and Tardas parvus. And this is actually the case. Renal artery stenosis causes a Doppler signal of Tardas parvus. So here, not in order, answer the question you are sure about them first, guess at the end. If you start guessing and you made a mistake, you will ruin up the question completely. And these are my references, and thank you for your attention.
Thank you, Professor Ahmed, so much for this very interesting and so practical lecture about how to manage or to crack, as you said, multiple choice questions. And indeed, not only multiple choice questions, but true and false questions and extended match questions, how to manage them scientifically in a highly practical way and you said many rules. Don't guess except at the end. Mostly tackle the longest sentence. All any sentence with mistake or spelling mistake is wrong. You are to know the psychology of your examiner by getting multiple examples of previous exams and to deal with this psychology in your coming exam and etc. etc. I have many questions. Let me start. What is the optimal time for MCQ question do you see to fit and is proper for answering that question? Is it 1 minute or more than 1 minute?
There's no proper time. It's all about the time allowed for the exam.
Yes.
You know, the time allowed for the exam, let's just say 2 hours for 60 questions.
Yes.
So, you know, 60 questions, in this case, if you give 2 minutes for each question, you finish at 2 hours, but you don't have any time for revision.
Yes.
So make it 1.5 minutes and rest for revision. So you have to manage your time at the beginning by knowing the time allowance, knowing the number of questions, because not all the questions will take the same time of answering. Some of them will take them easily, quickly. Some of them will need thinking. Some of them actually, you have to keep them in your mind and don't spend time on them. You may find a leading question or leading answer or a hint later on in one of the other.
Okay, but my question is, when I design an MCQ exam, do you recommend a specific time for each question, especially in the face of our long questions containing cases containing a lot of details? I can design an exam for 1 hour.
Yeah,
with
I
30
know what you
questions,
mean.
and I can do it.
Yeah,
Yes,
for
I can
example,
do it with 60 questions.
yeah, look, it depends. You know, if you have, you know, what we do in the Royal College,
Yes.
we'll do what's called gauging. We call it exam calibration. Exam calibration. We design the exam questions.
Yes.
And we answer them. We'll see how we're going to take to answer them, and how easy the questions are. So this is important to have exam calibration. And exam calibration will guide you regarding the timing. For example, one question has scenario with a lot of numbers and values and biopsy results and some lab results and all sorts of things. This is give it more time. Compared to one question, just the stem is one line and the options are quite limited. So it's variable, but it depends on the calibration. And this is actually a practice in the Royal College, but I'm afraid it's not a practice in most of the universities, where they don't give a clue about the exam calibration. Exam calibration is important. Not only that, the exam calibration will come up with, sometimes we delete questions. You know, this question is difficult to answer, the wording is weird, it's difficult to understand, it's not clear, we delete it. So it depends on the exam calibration you do it, and it depends on the difficulty. But if you have a 1 hour, so make sure that you get roughly 1 minute for each question.
Yes.
Roughly 1 minute.
This is my question mainly. So you recommend average 1 minute for each question. You find it the most suitable one. 1 minute for
you
each
have
question.
the question difficulty should be variable as well. One
Yes.
difficult, one easy, and this will compensate each other.
Yes, of course. Okay, we have a question on the chat coming to from your last answer about sorry. Can you hear me?
I can hear you, but I can. Where is
Yes.
the question?
About
Yes. To calculate
number
minimum pass level.
Number of easy and percent of easy and hard question. What do you recommend?
No, I mean, this is exactly how long piece of string is, because some difficult question for some will be easy for somebody else. The most important is that the question should be covering the whole curriculum.
Yes. And I think this will lead to the answer of the previous question on the chat. Can I know how to calculate the minimum pass level when structuring an exam?
Fine. Oh, okay. This is a difficult question, Sarah. This is a difficult question. I will tell you why. Because it depends on, for example, in the Royal College, we don't allow anyone to pass by chance. So what we do, we design a pass mark, and the pass mark is different between exams. The pass mark is the average mark of the students will get based on the exam calibration. We do the exam ourselves.
Yes.
And then we rate the pass mark instead, or let's just say the pass mark of this exam is 55. Yeah?
Yeah.
55%. Look, not 50. We'll raise the pass mark by 2 standard deviation. We'll make it 65. Why? Not to allow anyone to pass by chance. There's a problem in the Middle East, which, those people who pass the exam by chance are dangerous, are harmful to the society. We don't allow anyone with knowledge below the standard to pass. This is why you make the pass mark a bit higher than the actual pass mark. Do you get it?
Yes.
Yeah.
This is usually we do in MCQs.
Yeah. I mean, it's it's a practice in many places, actually. You raise a pass mark more than the actual pass mark to ensure that people who pass pass by chance. Yeah.
I have another question that you said that you are to go, or it is better to go all through all the exam before you start to answer. I think it's so difficult to pass by, especially in big exams, by 50 or 100 questions, and then return back to the first one and answer it.
Yeah.
But do you recommend a specific way to do this?
Look, basically, and you look at the exam question quickly, eyeball, it won't take 1 or 2 minutes.
I don't think so.
It's not reading. No, you can't read all options. You read actually, this one about pulmonary embolism, this one about tubulitis, this one about CMV infection, this one about BK virus.
This is I'm talking about.
So you read the top. This one is a clinical scenario. So this one about the X-ray, this one about CT scan. So basically, to have a rough idea, because for example, eyeball 1 about BK virus and eyeball 1 later on about BK virus as well. So it could be leading questions, because the question not being randomized. So this will give you a clue that if you're stuck in the first BK virus question, you might look at the BK virus second question, you might give you a clue. But not reading, eyeballing is just, flip the papers right and left and see what's all about. It won't take more than 1 or 2 minutes, not reading each question in details. Otherwise, you won't have time to answer the questions.
Okay, thank you. This is why I am speaking about what I am speaking about. If you go carefully, there will be no enough time. And what is I am more afraid of is that the time will be spent out in this. The candidate
Yeah,
will
no, just
read and go through reading, and finally he will find
no. What I said,
ask
screening.
this
You know,
this uh,
not reading, screening, just to know what it's all about.
okay. The screening the questions and the topics and what's speaking about,
Yeah.
just to match questions by the topics. Dr. Rehab is asking about in designing MCQ, is there is a percent of each cognitive level? If she is speaking about difficult, medium, or small, I think this is the question. Percent for each cognitive level among the questions. How many questions do you recommend to be difficult, and generally speaking, how many questions?
Again, I think I did answer this question before, because one question that's difficult for me could be easy for you, and other way around. It depends on the topics you studied. So, you know, it depends on the knowledge.
But I think, Professor Ahmed, that there is questions known to be easy for all, and the questions will be difficult for all. Yeah, not much difference. Direct questions, there are some direct.
Maybe some questions are difficult for everybody.
Yes.
Yeah, when I put a complex clinical scenario with a lot of possibilities, a lot of variables, and a lot of data, this is difficult for everybody.
And there are direct
variable difficulties, you know, because, you know, otherwise everybody will get the same mark. No, we don't get the same mark.
Are there any recommendations, or is there any recommendations for number of difficult and easy questions? Percentage?
No recommendation for
Average?
no. The whole idea is to cover the curriculum, having the questions very objectively designed, addressing the important points. You know, it's quite ridiculous to have a question about rare diseases, for example, you know, and occupying, it could be one options rather than one question about rare diseases. Therefore, it's important to be comprehensive and covering the curriculum. And this is how we design the MCQ, is just we need to screen your knowledge. We need to know if you know or you don't know. Also, don't forget, it's like a driving, like a cycling, like driving, like practicing music, like any other practice. Practice makes perfect. When you practice more MCQ based on knowledge, you'll be quicker.
Okay. So it needs much more practice.
Much more practice, much more learning.
Okay. Thank you. I have another question. You took much of your time, or some of your time, speaking about randomization of questions. What do you recommend? Is arranging questions alphabetically or randomization of choices?
Yeah, what I meant, and I mentioned it clearly, randomization of the answer.
Yes.
Yeah, answer. Yeah, randomization on the answer means, you know, the question comes with the correct option A. Try the next question. The option is B or C or D or E, not A.
I am speaking about some recommended. I read some recommendations to arrange answers alphabetically according to arrangement. So by the way, you cannot judge the sequence of answers. It may be C, 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 or maybe A, according as the answers, all the answers are arranged alphabetically in each question. So the correct answer will come in its place according to alphabetical arrangement. Do you recommend organization of answers according to examiner's vision?
No, I mean, it's not examiner vision, examiner's vision.
Yes.
Because, you know, I mean, one of the common practice, good practice in Royal College is a panel of examiners sit together, discuss the questions, answer the questions, identify the time required to answer these questions. Rather than one person, just, you know, during the night, you know, come up with 20, 30 questions. Next day morning, you know, throw the papers to the, you know, to the candidates, students, and ask them to answer. Some of the questions be incomprehensive, some of the questions spelling mistakes, some of the questions not conclusive at all. See a lot of things. So poor design. So it's better because even I'm sure you do the same thing, Professor Yasser. When you design a question and then leave it for a while and then come back to it, you change it.
Yes, many times. And of course,
yeah, we change it. So this means we are not perfect. It could be something in your mind, but you didn't put clearly on a paper, on writing. And this is why the panel or many examiners sitting together discussing each question separately, and we'll get a consensus. We'll go ahead with this question or not.
yes, exam committees are present in all of
yeah.
universities nowadays. No, not a single examiner, but I'm speaking examiner, meaning exam committee.
Yeah.
Or the charge to design the exam. So it is not recommended to a specific arrangement for answers, either alphabetical or not, according
no. Even it's not, never heard of this technique and never seen it in 20 years of designing MCQ questions for the Royal College and University of Liverpool. Never seen it.
Okay. My question again, and sorry for overloading you.
Not at all.
Your usual practice after the exam, when for the questions, no one answered these questions. No one answered these questions. No answer for these questions. Difficult questions, not answered by anyone. What do you do usually for such a question?
Yes. Oh yeah, as a marker. Yeah, when I mark them. Okay. This means something wrong with the panel of examiners, the examination committee, because this question was so difficult or very incomprehensive or difficult to understand. It should be removed from the data bank.
Removed from the data bank, and the mark regarding this example
distributed all over again. And this happens every now and then when sometimes we come up, we thought this is a straightforward question, no one answers. We delete these questions and distribute the mark on other questions.
Okay, and investigate what is the cause behind this, of course.
Yeah, of course, the panel will be the problem.
Okay. No more questions, and no more in chat. I can see no more questions on the chat, except for many thanks for you, Professor Ahmed, for this very comprehensive.
Thank you very much. Thank you, Professor.
And we thank you so much for being with us today in this very interesting session of Egyptian Society of Nephrology and Transplantation. And thank you so much, and thank you for everyone who shared in the interactive part of the session by answering the question. And Professor Ahmed said that all of you are good practicing these MCQ. Thank you for your share, and thank you, Professor Ahmed, for this lecture and for your interaction with us in the discussion, and very comprehensive lecture. And
thank you, Professor S, and thank you, Dr. Rami, for your introducing me, and looking forward to see you again in another session. Thank you.
Inshallah.
Thank you, Rami, our coordinator today, and excuse me to close this session. تصبحوا على خير والسلام عليكم ورحمة الله وبركاته.
عليكم السلام.